I do not like the way my eyes look. Do I have ptosis? I'm only 20 years old and feel like my eyes make me look much older because they are so droopy. I'm not sure what could be done about it or the cost. I notice when I'm driving, I have to lift my eyes up to see better and I get frequent headaches. I would love to have really nice almond-shaped eyes. Thank you for reading.
Thank you for your question. You're 20 years old and you state in your question that you don't like the way your eyelids look and you're asking if you have ptosis. And you describe in your question the situation where you are having difficulty keeping your eyes open when you're driving and that you have frequent headaches and you want to know what your options are. Well, I can certainly assist you with this question. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. This means that my background training was first in eye surgery, and then I underwent a specialty training in plastic and reconstructive surgery of the eyelids. And in that field, certainly ptosis is a very important area for what we do. I practice cosmetic oculofacial plastic and reconstructive surgery in Manhattan and Long Island, and I've been in practice for over 20 years. And so I've certainly treated a lot of ptosis. So with the single photo you submitted, in terms of understanding the definition of ptosis, I think we can be confident in just defining the presence of ptosis with that one photo. Now, ptosis basically means drooping. Now, when it's eyelid ptosis, it's called eyelid ptosis, but it could affect the breast, and it could be breast ptosis. So, as far as ptosis is concerned, the normal position of the eyelid is typically approximately 1 to 2 millimeters below the upper part of the colored part of the eye, the iris, so that there is at least about 2 millimeters from the center of the pupil or the approximate center that we refer to, called the light reflex or margin to eyelid reflex distance. So with that understood, looking at the way your eyelid is positioned relative to the pupil, I think it's very safe to state that you do have ptosis. Now, when someone like you who's 20 years old comes in, the question that I have first is this congenital ptosis, meaning that you were born with it, or is this acquired ptosis? Now, congenital ptosis can be present and it can slightly get worse as you get a little bit older. And with acquired ptosis, it's something that often needs a little bit more examination before moving forward with the surgical procedure. So it's important for you to look at photos. Look at the photos from a year ago, 2 years ago, 5 years ago. Look to see if you always had this. A lot of times people who are born with ptosis have never realized that they had ptosis, and sometimes they'll be told by their family and friends that they have, quote, bedroom eyes, which is fine. I mean, it also could be a kind of a natural, normal appearance, even though technically and medically speaking, it is ptosis. Now that being understood, if the eyelid appearance has been stable for a long time, then it is reasonable to consider a surgical procedure to help you have the eyes look more open. If, however, this is something that's new, well, it is important to at least see an ophthalmologist, and in particular possibly a neuroophthalmologist, to determine whether or not there may be a neurologic reason for this change. Given that this is a solitary photo, when I examine a patient with ptosis, I have them look down, look up, and I take measurements of the muscle function, and I review photos, and I will sometimes even have patients come back more than once to just see what they look like at different times. Establishing the diagnosis is critical before moving forward with the surgical procedure. And ptosis surgery can be very, very effective. It can really change the whole face. It's deceptively complex because it involves working with a muscle called the levator muscle. And depending on the level of ptosis you have, degree of ptosis, that muscle has to be, it needs to be dealt with and managed very, very carefully. In fact, it's routine for us when we do this type of surgery to actually sit a patient up during the procedure to adjust the position, the height, the contour, the shape, and adjust for the symmetry. So it's a very advanced eyelid procedure, and it's something that does require a lot of, I would say, a lot of experience and finesse to optimize the results. And even with all that, there can be variability to a degree in outcome. Your eyelid can be too open or too low, and you may require revision surgery. But again, that's more if this is the path that needs to be pursued once the proper diagnosis is made. So I recommend that you meet with a medical doctor or an ophthalmologist to first address this concern. Having the proper evaluation, and may require more than a couple of doctors in order to at least eliminate the possibility of a neurologic reason before moving forward with then ptosis surgery, and then identifying a ptosis surgery specialist who you feel would be right for you. I feel that the cosmetic elements of ptosis or any reconstructive surgery is so important, which is, my practice is cosmetic, oculofacial, plastic and reconstructive surgery, that's been an emphasis for patients who will often say to me that they've been to other oculoplastic surgeons, but because their offices, they did a lot more medical and less proportionally cosmetic, they felt more comfortable finding someone like myself. Now, of course, that's just one perspective, but that's just my experience in the decisions that I made many years ago in focusing on the cosmetic elements of even the reconstructive types of surgeries I do. So this is going to be a learning experience for you, and you should pursue meeting with doctors at this point moving forward. I think we can answer the question reasonably by saying yes, this does appear to be ptosis, but beyond that you need actual proper examination and physical evaluation to learn more about what your options are. So I hope that was helpful. I wish you the best of luck, and thank you for your question.